Welcome to the Kindness Warrior podcast. I'm your host, Carly Riggs, and today we have Dr. Jenny Kimes with us. Jenny is fabulous. She's going to be on many times because she's so knowledgeable on all things Down syndrome. She is our psychologist that we have on staff. She does an amazing presentation called DS 101. She presents about all kinds of things, but today we are focusing on the DS diet. I have to say this disclaimer that she's not an actual dietitian or a nutritionist, that she has come up with this diet for her own child who has Down syndrome and an autism diagnosis as well. And so her daughter has done so well on the diet, and her family, her typically developing children, and herself, her husband, they're all on this diet, and they're doing so well that she started sharing it, just shouting it from the rooftops that this has changed their life, and it's kind of gone from there. So we talk a lot about it, supplements, we talk about just everything DS diet related, and we also get to learn more about Jenny, and she's amazing. So if you have any questions for her or for us about it, feel free to reach out. All of our information will be at the end of the episode, and also will be in the show notes as well. And we're hoping to gather some recipes for you as well. So keep your eyes and ears peeled for some recipes that are Down syndrome diet friendly. We hope you enjoy Dr. Jenny Kimes.
You're listening to the Kindness Warrior Podcast, a Down Syndrome of Louisville production, serving locally, sharing globally.
So today we're so excited to have Dr. Jenny Kimes here with us. Jenny, thank you so much for joining us today.
Thanks for having me.
Jenny is an expert on many things. She's shaking her head at me, but it's very true. So many things, in fact, that we hope to have her on an episode every season because my list is very long of things that Jenny is an expert about and that you, our listeners, are most eager to hear about. So today we're going to focus mostly on the Down syndrome diet. But first, I want to learn more about you.
Oh, okay.
So tell us a little bit about your role here at DSL.
Well, it seems to ebb and flow and change every few years, but right now I'm acting as the clinical director, which means I have a caseload of first steps babies that I see in the home. I also get to work with some of our amazing adults who are in ADA and an outpatient basis. I do some testing, and I'm available for the programming staff for any clinical consultation, and still stay in touch with all my early ed families who have school issues that crop up or behavior concerns.
Amazing. So testing, you mean what kind of testing?
Well, some of it is psychological testing just to establish that our member has an intellectual disability. That's part of the waiver, Medicaid waiver eligibility requirement. Mm-hmm. Some is for autism rule-outs. So if we have families who think there might be something else going on with their child and they just want more detailed evaluation, we can do that too.
Wonderful. So you've been here, how long have you been here?
It'll be 16 years this summer.
Oh my goodness, yeah. 16 years, wow. So let's go back. We're going to go back. Okay. And I want to learn more about you. I've been here about 7 years, and I know all of the things that you do here, but that's about it. So I'm really excited to get to know you a little bit more. Yeah. So did you grow up here in Louisville?
I did not. Actually, I'm a military brat, so I traveled around a lot. I've lived overseas, and that was exciting. Of course, I was very young then. But I spent probably the most time, aside from being here in Louisville, in Philadelphia. Went to undergraduate and got my master's degree in Philadelphia.
Master's degree, what did you study?
Well, my undergrad degrees are in psychology and early childhood elementary ed, so I have a teaching certificate for early childhood and elementary, and then decided I love teaching, but I decided I really wanted to learn more about how children tick and what affects them and the whole family system. So I went back and got a master's in counseling psychology.
Oh, wow.
And then realized, well, there's not really much you can do with a master's in counseling psychology. So I was young and unattached at the time, so I just kept on going to school, got my doctoral degree, and that's what brought me to Louisville, Kentucky. I went to Spalding and got my PsyD degree in clinical psychology.
Okay. And so that whole time you had not met your husband. Is that correct?
I was almost finished with my doctoral degree when I met my husband.
Okay.
Yeah.
So what do you think brought you to psychology?
Well, I think really wanting to know more about children's behavior. My passion, of course, is children, but I work with, all ages.
Sure.
But when I was teaching, in the classroom, I'd see two children maybe exhibiting the same behavior, but for very different reasons. So one would be more of an oppositional defiant type. One would be more of a sensory processing type. Another would be situational. Family was going through divorce and not knowing how to address the behavior to really take into account all those different etiologies of the behavior. So I wanted to learn more and went into psychology.
That's so interesting. Okay, so then you met husband.
Yes.
Okay,
yes.
And that was here in Louisville?
In Louisville, yes. Actually moved in right next door to him.
Oh.
Yeah. So
and that's how you met?
married the boy next door, yes.
That's how you met?
Yes,
Oh my
yeah.
gosh, I love that.
Yeah.
And then, so at what time are we talking? What year?
Oh, 1996, 97.
Okay.
Yeah.
And then you get married. And so then your family, first comes love, and so you start having kiddos, right?
Right. So my first daughter happens to have a diagnosis of Down syndrome.
Okay, so I was gonna ask. Tabby came along, but I didn't know if she was your first. So she's your oldest.
She's my oldest.
Okay.
And so that's really what propelled me into this world. I really had no background in special ed. Hadn't had a lot of training or experience even in my undergrad teaching training. So I was almost finished with my graduate work, and along comes Tabitha, my pride and joy. And it really catapulted me into this whole new world. And even my dissertation is about Down syndrome and Down syndrome of Louisville. So I kind of embraced it and ran with it.
Yes.
But the predecessor here at DSL, Jean Bryson, who was running the early ed program, after I had completed my schooling and had done my internship, she retired. And Down syndrome of Louisville had always been sort of our support system, and Tabby went through the early ed program here. But we had moved away so I could do my internship, and I found out she was retiring, and Diana Merzweiler, our former executive director, called me and said, hey, would you be interested in applying for Jean's position? Because I had the teaching background. And that position primarily was working with young children. It didn't necessitate my psychology experience, but I thought this is a great fit to work with young children and young children with Down syndrome, which I was living.
Yeah.
Right. And then also to focus on their neuronal development, really to get them in a great place cognitively for lifelong learning, not just for early ed development.
Yeah. So what was Down syndrome of Louisville at that time?
Oh, that was my rock. I mean, it was very small. It's amazing. Down syndrome of Louisville, when I came on board, we had 4 employees, 4 or 5 maybe, and we were filling in. We were growing rapidly and filling in programming as the need arose, but they were a staple in our lives for support systems. I will not to get too far off track, but we lived in Eastern Kentucky while I was finishing my internship, and we didn't see anyone with a diagnosis of Down syndrome in the community. And I knew they were out there statistically. We even went to a couple of parent support programs that the health department put on, and several times we were the only family that showed up.
Oh my gosh.
So I knew, I had days where I was crying going, I need to go back to Louisville. I need Down syndrome of Louisville. As my support system.
Yeah.
So I was thrilled to be able to work here in a capacity that...
Yes, and at the time, I hear tales of the days back then. Yeah. And did you meet in other people's homes at that time?
At that time, we were still working at a field elementary.
Okay.
And so we had, when Jean actually retired, we split our contractual relationship with JCPS, so we could no longer use the school.
Okay.
So that's when we moved to Douglas Boulevard Christian Church, and we rented a classroom space there.
Okay.
And then we moved over to the small yellow house, I call it, on Bardstown Road before we built this building.
Oh my gosh.
So I was providing services through First Steps in people's homes.
I think maybe I'm referring to someone might have told me about some potlucks, maybe some family potlucks that were in different people's homes.
Yes,
maybe when,
and events and parties and things.
That were in people's homes. That's so great. Okay, so you're hired here, and you know, now all of these years later, I want you to tell me, like, looking back, what was it like for you when you got Tabby's diagnosis?
Yeah. Well, and that was an interesting journey because Tabitha had started to show some symptoms and signs of autism before we even moved back to Louisville. She was almost 3, and we had to enroll her in childcare. And she'd always been a very social, communicative, well-behaved child, very compliant, go with the flow. And she started withdrawing and becoming, it seemed, overwhelmed in her classroom. And she would hide in the corner and lash out. And she started to not follow directions anymore, and more sensory issues came up. So at that time, we attributed it to, new move. Then baby sister came along. And so in my work schedule, I had always been a part-time stay-at-home mom until then. So I was very swamped with finishing my internship and postdoc. And so I attributed a lot of what she was going through to just situational factors, things going on, phase of life things. We moved back to Louisville, and she, even after we got kind of settled in, her symptoms weren't getting better. She was getting worse, showing some regression. And even then, I felt like something else was going on. But we had other diagnoses like receptive expressive language disorder, sensory processing disorder, apraxia, verbal language apraxia. So I kind of thought it's all of these things going on. Well, when she was about 7 or 8 years old, I was also doing some kind of more intensive work with children. I call them typically developing children with autism. So they did not have Down syndrome. They just had a diagnosis of autism. And I really started noticing some similarities, thinking Tabitha is more like these children than she is her peer group with Down syndrome. And knowing that when we went to potluck suppers and the events and social functions here at DSL, Tabitha was not acting like the other children with Down syndrome. So feeling, very different, I think, at that point, like what's going on. And here I am working in this field, if I should know, what her needs were, but really not knowing what was going on. At that time, we knew the average age of diagnosis for children with Down syndrome with the secondary diagnosis of autism is about 8 or 9. And so I think I can see where that might be because you've sort of exhausted all other explanations at that point. We didn't have her officially diagnosed. Since I'm a licensed psychologist, I've given her several screening tools, and she's scored off the charts. She definitely fits the profile, but it would just be a matter of taking her to an outpatient psychologist and have her officially diagnosed.
Absolutely. So if let's say that we've got some listeners who are thinking that this sounds like my child, what you just were telling me all about, what would the steps be?
Well, I'm a fan of the earlier the better, and I'm not about labeling children too young or unnecessarily, but some families to kind of a catalyst to get them to comply with the treatment protocol or to consider other interventions need the diagnosis, need the label. And so I think the earlier the better. And for some children that we've worked with, we've seen some behaviors and symptoms manifesting, but if we can kind of catch it early enough and thwart off needing that diagnosis later on, we've been able to sort of steer the ship in a different direction.
Absolutely.
But I think as a parent to really look at all potential options. Don't be like me and stick your head in the sand and say, well, maybe she'll outgrow it. She just needs another year of maturity.
Right. Because it seems like it is so helpful to just know. Because then at least from what I have learned with some of our families, it was like once they knew, then it's like, okay, now
Yes.
we know,
it makes sense.
yes,
Yeah,
this makes sense.
Yeah.
And so let's dive into the DS diet, because I know there's a lot of information. So tell me how it started. How did your deep dive into this start?
And this was really funny when I talk about it now, because it was sort of this like covert operation, because there wasn't a lot of information 12, 13 years ago about this. And everything was sort of written by professionals or moms, like on the banned book list, like mainstream medical.
Like, I heard this. Yeah.
So we're all sort of doing things secretly. But really, when I was working with children with autism, some of their families were seeing these doctors. They were called DAN doctors, Defeat Autism Now doctors. And at the time, there weren't even any in Kentucky. So families were crossing state lines to get information from these doctors who felt like autism was more of a biological, a health-related issue versus a psychological disorder.
Okay.
And so the families were adopting some dietary interventions, gluten, casein-free diet. Some of them were supplementing. And I was doing this really intensive ABA, applied behavior analysis work, working with children, and we were seeing change, but it was very slow and very methodical and very challenging. But the families who were using the diet, I was seeing change at a much more rapid pace. So working on a skill that children were acquiring within days versus what previously took months.
Wow.
And I was fascinated by why this is so. And at the time, the parallel process is my daughter's manifesting more and more symptoms, and we're having more and more challenges at home with her reactivity and shutdown and sensory issues. And so I really just dove into the literature at that time about dietary interventions, and was doing things for our daughter as well, just following the lead of other parents, what they were doing.
Yeah, absolutely.
And it wasn't until about 2014 when I read this life-changing book. It's David Perlmutter's Grain Brain book. I think it was published in 2013. And I opened up the cover and started reading the first few pages, and what he was describing as related to gluten specifically, I was like, wow, this 11 of the 13 things that he mentioned pertain to our members with Down syndrome.
Wow.
And so I thought, if diet can affect all of these things, how much more beneficial could it be?
Sure.
For our
and that's
members
called
as well.
Grain Brain, you said?
Grain Brain.
Grain Brain.
Mm-hmm.
Okay, so let's start from the beginning, because I did an inquiry on our social media and said, what are your questions about Down syndrome? And a bunch of people said, or Down syndrome diet. What is the Down syndrome diet? And several people said, what is the Down syndrome diet?
Right.
So just what is it? Let's start from the beginning. Yeah.
So basically it's adopting really a lifestyle. So a low processed foods, low refined sugar, low simple carbohydrate diet, high healthy fats, and then looking at the specific things that our members struggle with, like digestive issues, and how we can eat to avoid those, minimize those, and possibly supplement if our members are deficient in something, because we know that people with Down syndrome do have some nutritional deficiencies. Ironically, there's a lot of shared nutritional deficiencies with people with autism, which I hypothesize is why we also have such a high rate in our population. And how do we get the body in optimal operating order so that we can minimize some of the health-related issues and developmental issues, and possibly even avoid major diagnostic and developmental issues like autism and possibly Alzheimer's down the road.
Wow.
Yeah.
Wow. So if someone were to ask me what is the Down syndrome diet, I'd say it's a lifestyle.
It is a lifestyle. Yeah.
So it's not necessarily specific, like, well, and we're gonna go through it, but it's less like only eat this,
right?
And more just like let's try our best to avoid certain things and maybe supplement.
Absolutely. It's a lot of removing what isn't good for any of us, really. And then making sure that our children have all of the nutritional needs, get them back up to where they need to be. If you have to supplement, you have to supplement. If you can do that through food alone, that's fantastic. But we also know that our members can be picky eaters.
Sure.
Some of our members are very young, and that's more challenging.
Yeah. Okay, so let's go through it.
Yeah.
Gluten is a huge one, grain brain.
Yes, yeah.
So tell us about gluten and what it does to our mind
Right.
and our body.
So gluten, that gluten protein that's in wheat, barley, and rye can have an effect on our GI system. And if you have any kind of compromised gastrointestinal system, which we know many people with Down syndrome do, whether that's manifest through symptoms or just kind of bubbling under the surface that we don't know about but is actually happening, and those proteins go right through what they've termed the leaky gut. If your GI system's not in great working order. And what wheat does is wheat actually is, there's a chemical called zonulin, and that will open the barrier in your gut, and that's very individual specific. So if I eat wheat and my zonulin opens my gate for 5 minutes, then I can have any of those toxins pass through gastrointestinal system into my blood-brain barrier and right to my brain for that 5 minutes, and then it'll close. Well, some people, that zonulin, affects, it opens those gates for an hour, 3 hours, 3 days. It can depend on the individual. But basically, all of the toxins that are in your gastrointestinal system are basically allowed to pass through, and you have a systemic issue where you're not absorbing the nutrients you need to absorb. You have toxic buildup in your system. A lot of people complain about brain fog because all of that junk is going right to your brain, especially when they're on a high gluten diet.
Wow.
And then there's the secondary process of all of that happening actually compromises your immune system. And if your gastrointestinal system is compromised, what can often happen is an inflammatory response is triggered because your body knows this isn't right. It starts attacking itself. There's some antibodies in here that shouldn't be. I need to attack myself. You get this chronic inflammation because your body thinks you're sick. And that inflammation, chronic inflammation, is not good for our brain. And they're attributing later Alzheimer's with chronic inflammation.
Wow.
In our bodies.
My goodness. So we're avoiding gluten.
And it's easier said than done, right?
We're trying our best to avoid
Right,
gluten, as much gluten as we can.
And I will say there's some research showing, ancient gluten isn't so problematic for some people in their systems, where modern gluten, really wheat developed after 1950s or so, that's hybridized, that we have quick rise flour now, and that can be more problematic. So for some folks who are eating ancient grains, like an amaranth or einkorn or something, of that nature, they might be able to tolerate, so there is some emerging research about ancient gluten, ancient grain gluten versus modern gluten. But most of what we eat every single day is this modern.
Sure. And that's
refined.
Okay, so gluten, what's next? Sugar?
Sugar. So if you can keep gluten to a minimum or get rid of altogether, the next thing, would be sugar. And I think going low carb, simple carb, refined carbs is better anyway, because what happens even if you get rid of sugar, if you're a high carber, that those carbs turn into sugar.
Sure.
So, I think it's both you need to do in tandem. So low processed carbohydrates and low table sugar. We know that our American diet is packed full of sugar, and obviously none of us are sitting at home spoon feeding our children tablespoon after tablespoon of table sugar.
Right.
But it is secretly in everything. And I think really as informed consumers, once I started researching about food, I didn't realize how many products hide sugar. They call it different things, any kind of OS word, sucralose, glucose, saccharose, everything is disguised as sugar. And once we take it out of our everyday, I mean, I know even for my own daughter, she'll have the occasional treat. She'll have,
Sure.
We might have a gluten-free something, or she loves her chocolate, that monthly time. But, we're not eating it all day, every day.
Yeah, absolutely. Okay, so we got gluten, we got sugar. What's next?
I would say for our younger members to really evaluate dairy.
Okay.
Because some of our members, a high percentage, might have some reactions to cow's milk, and there are so many alternatives out there. And I know some people in the medical profession, get up in arms about that, but really, we don't need to be drinking cow's milk. We do need to be drinking something with enough fatty acids and vitamin A and vitamin D and calories and everything that milk has in it. But if we can find that in a different way that doesn't cause the maybe histamine reaction, because cow's protein can cause a histamine reaction, which causes mucus production. And because our members have small sinuses and eustachian tubes, when you get that mucus buildup and there's no good drainage flow to get rid of it, it can cause sinus and ear infections. The other thing that casein in the cow's milk can do is cause some skin irritation, skin rashes. For our younger families, I'll often say they have the milk face. They'll get redness on their cheeks right after they drink milk. It can cause constipation or diarrhea. I will see it more often than not. I will say, after doing this 16 years and working with First Steps, when those babies transition from formula onto a cow milk product, we usually have some kind of issue more often than not, which can be addressed by switching to another product and possibly supplementing with the things that product
May not have. Absolutely.
Yeah.
Okay, so gluten. I'm just going to keep doing it. Gluten, sugar, dairy.
Yes.
What else?
I think healthy fats. We
Okay.
leave out healthy fats, and our brain needs fat. It's 50, after water, it's mostly fat. And we have demonized fat. We've even demonized cholesterol. But really, cholesterol is not the demon, right? It's when cholesterol gets glycated, when it mixes with sugar. So I'm not saying go eat 3 pounds of bacon, but healthy fats and even healthy animal fats. So we want lots of avocado, we want coconut oil, we want some good protein sources, eggs, good meats, leave the fat on, as long as they're a good source of meat, not GMO and processed.
Great.
Yeah.
Okay, so doing it again.
Yes.
Gluten. We're adding things. So we're going to try to avoid gluten, avoid sugar, avoid dairy. We want healthy fats.
Yes.
And what else?
Well, one of the big supplements that I'll talk about, and I always, before you do any supplement routine, cross-check with your healthcare provider, but probiotics. Probiotics, I think if I have to tell anybody any one thing, would be a good quality probiotic, because if you don't have good gut functioning, the rest is down the toilet, literally. Pardon the pun. Pardon the pun. But really, if your gut is compromised and you're not going to heal it until you get good gut health. 80% of the immune system starts in the gut. Our neurotransmitters for anxiety and depression manufactured in the gut. They're really calling our gut microbiome the second brain, because we now know of that gut-brain connection, and we know historically that our members typically have some gut dysfunction issues outside of the big things like Hirschsprung's and celiac. They can have some smaller things that might not manifest in this overt diarrhea, constipation, but other issues bubbling underneath the surface.
Yeah, absolutely. So probiotic. Are there any other supplements you suggest?
Well, I do, depending on the individual. It's hard to get all the healthy fats that we need every day through our food. So many of our members will supplement with some omega-3 fatty acids. That can be fish oil. That can be MCT oil, which is a medium-chain triglyceride similar to coconut oil. They will supplement with that. Depending on what the individual's going through. I always recommend, good comprehensive multivitamin for our members, because we do know that they have some nutritional deficiencies, sometimes digestive enzymes. If you can't control the diet, if the child's at daycare, school. Our big thing was potluck suppers at church. My daughter was sneaking things, so we had her on a digestive enzyme for those breaches in her diet, but those may be beneficial all the time, depending on what your healthcare provider tells you.
Absolutely. Before I ask about your personal experience with the diet, is there anything else that you think should be mentioned as far as like things to avoid, things to add to your diet?
Well, I think if you're avoiding just anything processed, you're trying to eat as clean. My big thing is clean eating. So eat as true to the source of the animal or plant as you can. Go organic, non-GMO, if at all possible, because we know some of the toxins that are in those pesticides, that are in the antibiotics in the animals, that those can cause some other issues. Avoid non-GMO or GMO soy. So because soy, unfortunately, we know the connection with genetically modified plants and glyphosate, which is connected to some pesticides, and that causes toxic buildup, and so trying to avoid that if possible.
Yeah, absolutely. So tell us about we know that like you have come up with this amazing list that we've been talking about over years and years and years. Yeah. So how has it affected your daughter and you? I mean, you are on this diet as well, correct?
Right. So funny story about that. Tabitha's been on the diet since she was about 8 or 9 years old. And, we had our own journeys, and I love to talk to families about how to get through those hurdles about introducing the diet, because that can be a whole nother thing. But we realized after reading David Perlmutter's book that Tabitha might not have Alzheimer's someday, but she wouldn't know, or we wouldn't know who the heck she was, because all the rest of us would have. Yeah. And over the course of parenting, Tabitha has 3 younger siblings, and I've used some of these dietary interventions with all of them. Her younger sister, who is 4 years younger, has some lactose sensitivity and breaks out and gets nauseated when she drinks milk and cheese and ice cream. So we know our family probably has a sensitivity. My now 12-year-old at age 3 developed a tic disorder. He was craving milk, drinking lots of milk. I pulled him off milk. The tics went away. It was like a vocal and motor tic that was getting worse. So I thought, maybe I'm just crazy. Put him back on cow's milk. It came back. Wow. So he went off immediately. And then, of course, the baby, who's now 7, has never, we don't do cow's milk at home. But yeah, it's our whole family has adopted a lower gluten lifestyle, where Tabby is more gluten-free than any of the rest of us.
So over the years, I mean, how have you noticed a difference in her? Yeah. Well, I know she's been on it for years, but back then, yeah.
Yeah, and one thing I will say is the sooner you intervene, the more changes I do see in some of the members that I collaborate with, their families. And so I wish we had started earlier. She had some major changes when we started at 8 or 9. But if we had started at 2 or 3, I think this changes would be a little more profound.
Oh, wow. Okay.
But one thing I encourage families to do is, as you introduce things, and I do say to do this as more of an evolution. So don't go cold turkey because literally your body will be detoxing from all of this. Our family went cold turkey from processed food over the weekend, and I had such a headache just taking the chemicals out of my body for one weekend. And usually I get a phone call at 10 o'clock at night from a family whose child, I hear them wailing in the background. I'm like, no, don't cold turkey it. Let's just replace one thing at a time. So, but I would encourage families to keep a journal. So as they add, one thing or take away one thing in their diet, document all of those changes, because sometimes we miss the subtle things day to day. Yeah. But if you can go back and look and say, oh, it was within a week of taking this supplement, we started doing this or stopped doing that.
Absolutely.
It can be really helpful.
Absolutely. So if they start to do this evolution, this food evolution, what types of things are they going to see?
Well, some of the changes that families report right away are just a decrease in a sense. They usually describe it as, my child just doesn't feel comfortable in their own skin. They're agitated, antsy, irritable. Every little thing sets them off. They can't get comfortable. We noticed an immediate, well, I won't say immediate, but within several days and over the course of 3 weeks that her tantrums had decreased significantly.
Wow.
She was just more easygoing. She started following directions a little bit better. So if I usually had to repeat things and start with a direction and then give a verbal or a physical prompt and then pretty much help her do it. And so now I could give her direction and she would do it.
Wow.
So that was huge. She became less agitated when we went out in public. She didn't fight normal daily routines. I didn't have to prep her so much for every subtle change in the day. That was much better just doing gluten.
So was Tabitha a pretty good eater to begin with?
She was. She went through her phase where she would pick out the vegetables, that I tried to sneak in food and spit them out. But overall, she didn't have a lot of the oral or texture defensiveness that many of our children can have. She still doesn't like to chew her food, which, we try to address early on too, just building jaw strength and stability to help chew, which decreases some risk of choking and gets children at least tolerating certain crunchy and chewy foods.
Absolutely. So on that same note, like what should a family do if their child has oral aversion or doesn't like to chew or doesn't like crunchy or?
Yeah, so I think for our kids it can be twofold. It can be a sensory issue, so just having slimy or crunchy or sticky, whatever their individual aversion is in their mouth, and so doing some systematic desensitization, working with an OT or using some sensory, protocols to kind of decrease that over time is good. If it's just, I don't want to chew because my low muscle tone and my jaw strength isn't there, and so I'm just going to do a couple chews and gulp, so building that jaw strength, there's some exercises you can do, biting on some bite-activated toys, really building that up, working that tongue so they're putting the food in the right position, making sure they're not pushing the food to their palate and pushing it out of their mouth, pulling the food back.
So as far as the diet is concerned, for these families that are having some of these obstacles, do you suggest like smoothies?
I do. I love smoothies. I'm glad you brought that one up because you can sneak so much in a smoothie and it still tastes great.
Yeah, absolutely. That's what I
and I think the cold, many of our members like the cold, and the texture is much more palatable, pardon the pun, and you can hide a lot in, so you can put some supplements. Our smoothies, we put in coconut oil or MCT oil.
Oh, nice. That's very good. Okay, so what does either for you or for Tabitha, what does her diet look like for one day? Can you tell me like what a day would be like for her?
Yeah, so for breakfast, I make frittatas ahead of time. I will say that we've had to prepare a lot of foods ahead of time. The freezer's our friend, and pull things out. So she'll have a frittata for lunch, which is just egg and sausage, some onion, and she loves salsa. And for lunch, she usually does like a meat patty or a skinless or grilled chicken. At school, she's on a gluten, casein-free diet at school. She eats a lot of vegetables. Thankfully, she loves her vegetables and fruits. But she loves animal protein, too. She loves beef sticks. She loves raisins. We do some fruit bars that do have a high natural sugar count. It's sweetened by dates or blueberries. But there's no processed sugar in there. So, and for dinner, she might have some gluten-free pasta, or we'll do some rice. Again, she likes salad, but we started salads really early.
Yeah. I think I recently read some like parent hacks on how you can get your kids, and one person said that their dad used to when they were punished, their dad would be like, no salad. And so then then now as an adult they're like love salad because they can eat salad whenever they want. I was like, that's so hilarious. No salad for you. Super smart. So some of my questions here from parents are, what do you eat for breakfast? And you just told us. Someone had a question about pea protein.
Yes.
I have never heard of pea protein.
Yes. Yeah. So, my it's funny you should bring that up because my second daughter, who does not have Down syndrome, did a lot of smoothies for a while because they were easy. And one thing we started to notice is with whey or caseinate protein powder that would go in the smoothie, because she could have a smoothie and she wanted something to sustain her for the rest of the day at school. So we did protein powder, but a dairy-based protein powder was upsetting her stomach. So some folks are going to like a vegetable-based protein powder. And there is pea protein powder. And I had not heard that, so I just did a little research about that. And the one thing I think it might be pertaining to is that, and I wrote this down here, that pea protein is higher in purines, and purines convert to uric acid. And so that can be contraindicated in people who have any kind of kidney dysfunction, because it can't get rid of the uric acid.
So essentially, if someone is interested in adding pea protein, then they might want to just talk to their physician and see if it's cool.
And we've now, if we started the dietary interventions when she was younger, we probably would have needed to supplement in our smoothies with more protein. But we started them a little bit later, and so she gets a lot of animal protein. So we don't supplement with protein for her, because she gets it naturally.
Great. Did we miss anything? Is there anything else that you like to talk about when you present about this that we want to cover?
One more thing I wanted to mention, another supplement we use, we do a variety of things. We do calcium because she's casein-free, and we supplement with vitamin D because we know that's a deficiency. We supplement with CoQ10 because that's a great beta-amyloid plaque preventer. And we can talk more when we talk, about Alzheimer's and how our members are more at risk because of that beta-amyloid protein. But we also do glutathione, and I really recommend that. Children with autism and Down syndrome are deficient in glutathione, but I really see a vast improvement with our members who are possibly on the spectrum that start glutathione, because it's such a great anti-inflammatory. It's great for your immune system. It's like a master detoxifying agent. And we noticed improvements within 24 hours when Tabitha went on glutathione.
Improvements in what way?
Well, her social skills. Previously she'd been one to, when she woke up in the morning on the weekend, she'd want to stay in her room. We were the ones that had to go up there and get her out, pull her out to be social, get her day going. The day after we started, she came down to our room, threw the door open, and said, "Hi, Daddy."
No
and first
way.
of all, she'd never
That just gave me goosebumps.
Initiated that social contact,
Yeah.
but also just to even the vocalization that she'd not done, before. So I see, and we have a lot of testimonials of that. Children are much more social and communicative with some glutathione, and I think it's because it helps reduce some of that inflammation when your body's under that stress because of your diet. It kind of puts out the fire, and when you're not in internal discomfort, you tend to be a little more social and communicative, and can help with a lot of that.
That's called glutathione.
Glutathione.
And can you find that anywhere?
And it's different from gluten. Some people confuse glutathione with gluten.
Sure.
You can find it, I would say, find a really good source from a reputable company that you trust. Sometimes you might have to go to a healthcare provider or someone who's familiar with integrative medicine or functional medicine. You can order it online, but I encourage families to really get some guidance from someone who has a background in pharmacy or healthcare.
Well, and also you're here, and so they could reach out to you and talk to you. I know you can't get them glutathione. But they could talk to you about their child and blah blah.
Talk about the benefits.
That's one of the amazing things about Down Syndrome of Louisville is that you're here, and you're here to guide them and help them with these things. So we're going to take a little break, and then we're going to talk to Zach Callie, who is one of our adults who is on the Down syndrome diet, and we're going to talk to him about his experience. So we'll be back.
This has been the Kindness Warrior Podcast, a Down Syndrome of Louisville production. To learn more about Down Syndrome of Louisville, visit our website, downsyndromeoflouisville.org. If you have questions for us, email kindnesswarriorpod@dsoflou.org. It's also in the show notes. Music was written and produced by Alex Stotts and Owen Eiler. This episode was produced and edited by Ethan Holstein and me, Martin Lindsay. Your host was Carly Riggs. Thanks for listening to the Kindness Warrior Podcast here at Down Syndrome of Louisville. We are serving locally and sharing globally.